So dementia is a progressive brain condition which affects the cognitive abilities of a person who's affected by the illness. So when we say cognitive ability, it affects memory, language, judgment, personality, and lot more other facets of mental ability. It is an age-related disorder. It usually affects people who are elders, and it is irreversible, progressive, and as the disease progresses, it also interferes with the activities of daily living. So the person who is affected by the disease is not able to perform their day-to-day activities independently. They would need help, and eventually they do become dependent on others to actually carry out their daily tasks. Dementia and Alzheimer's are often confused or used interchangeably. Alzheimer's actually is a type of dementia. There are different types of dementia. Alzheimer's is the most common type of dementia that is seen worldwide. Alzheimer's disease usually has a gradual onset, and as it progresses, the cognitive abilities decline rapidly. Alzheimer's disease is usually defined by neurofibrillary tangles and senile plaques in the brain, due to which the person tends to lose the cognitive abilities. Thereby, they also lose the independence to do their activities of daily living. Usually, we say that it affects multiple cognitive domains. Most of the time, it starts with memory and then moves on to language or judgment or even ability to perform their routine tasks. Dementia is usually known as the disease of the elderly. Whenever we talk about dementia, most of the people whom we see with dementia are people who are above the age of 60. However, there are younger onset dementias as well. We define anything that is diagnosed before the age of 65 as a younger onset dementia. Thankfully, there are only 9% of dementias which are younger onset, and there are few which are really younger onset, like people at their 30 and 35. But those dementias are mostly genetic. That means that they do carry a gene which is probably matched to getting the risk of dementias in their later life. Diagnosis of dementia requires a comprehensive approach. There's no one single way of diagnosing dementia. The first one would be a detailed history taking. Second one would be ordering physical exams to rule out any reversible causes of dementia. Third will be mental state examination and examination of activities of daily living using various scales, which usually a psychologist would administer. And the last one is, of course, will be brain scans to rule out any cancerous conditions or any other brain related issues which could actually cause dementia related symptoms. So it's pretty much using all of these together to diagnose dementia, and it is usually said as a diagnosis of exclusion. So we exclude all reversible causes and then arrive at the conclusion of dementia. Unfortunately, dementia doesn't have a cure yet. It's because of the very nature of the brain cells. So once brain cells are damaged, they remain damaged. So till now there isn't a cure for dementia, but then dementia can be managed, treated based on the symptoms. So there are certain drugs which are licensed for dementia. We call them cognitive enhancers, so who help to delay the progression of the disease. And of course then there are symptomatic treatment wherein we try to manage the person with dementia. If at all they have difficult behavior, if they have mood disorder, all those can be managed by medications that are licensed for treating such problems. Other than that, we also have non-pharmacological therapies that can be engaged to help the person to cope up with the disease, cope up with the behavior. So there has been of late a lot of focus on non-pharmacological management. So there are different kind of therapies like music therapy, reminiscence, cognitive therapy, cognitive behavioral therapy. So there are a range of therapies that one could engage to manage the disease. Dementia is a very complicated illness to understand. Worldwide, people are trying to find the cure for dementia. As we don't have it right now, people are now looking into prevention. that how can dementia be prevented. According to research that is happening worldwide, there are some risk factors for dementia such as diabetes, hypertension, inactive lifestyle, not engaging cognitively, being socially isolated. All these are identified risk factors for dementia, including alcoholism, smoking, even air pollution for that matter. So all these are coming up as research are happening worldwide. For prevention, what one can do is to manage cardiovascular risk factors better. So managing diabetes, hypertension, cardiac issues, cholesterol better, having good amount of physical activity, and also engaging in cognitive activity, engaging in brain activity, and socialization is something that is extremely crucial when it comes to dementia prevention, as depression is again something which is very common in the elderly, and it can mimic dementia sometime and can lead to dementia also. Diagnosis of dementia can be life-changing, can be very emotional and devastating for the person who's suffering from the disease and for the family. So dementia requires services across the journey that the family member and the person with dementia has to take. Nightingales Medical Trust is different in terms of giving the services from the time of diagnosis till throughout the journey of dementia care. For example, the first step would be actually to get a diagnosis. In India, less than 10% of people ever get a diagnosis. Nightingales Medical Trust has online and offline memory clinic for assessment of memory loss or any sort of cognitive decline, and establish a diagnosis of dementia where people can understand the disease better, how to manage, they learn about it. That would be the first step. The second step is the daycare service, wherein we try to engage and rehabilitate the person in a daycare setting so that a family caregiver can get a break. At the same time, we keep the person cognitively and physically engaged. Then the next stage, when everything has failed, the family has tried to keep them at home, they've tried daycare service, they've tried everything, we have got institutional care set up as a last resort, wherein the family can send them for being cared through professional people and given the best quality of care setting. So that is there in residential care setup. So we have training for family caregivers or caregivers that the family members identify to look after their loved one at home. So we try to train them, empower them to handle dementia better at home. Also at Nightingales Medical Trust, we try to support people through support group meetings where the family members who have someone with dementia at home can come together in a common platform and share each other's experience.